Health authorities have activated their most serious response level
after an outbreak of a new type of viral pneumonia
in central China.
This is truly an unprecedented situation.
This virus doesn't discriminate. It attacks everyone.
I want every American to be prepared for the hard days that lie ahead.
The most profound moment for me personally with the COVID-19 and the reality of it was when Barbara came around from education. She came to gather us all to go over the PPE equipment. When that happened, it just became a reality. I just remember standing there and thinking, oh my gosh, what's happening? I remember clearly after she went through it, Martina demonstrated putting it on. She sort of looked around and asked if anybody had questions. I usually have a billion questions. I had none. And she actually said to me, Heather, do you have any questions? And I said, not at this time. And that really impacted me.
Yeah, I remember sitting, and I was sitting in the front row. And I'm looking over, seeing the first I see were the bats. And I said, oh, we're getting this from bats. And then I said, is this really happening? Is this true? Am I dreaming? You know, you think that you're in another place. Maybe I just wake
Like this
up.
is going to happen to us.
No, exactly.
A week before we got hit, you know, we were having discussions and prepping and learning about it and talking about PPE and having all these discussions around it. I think if everybody remembers, we were in the middle of triannual Joint Commission poll survey, so I think that was on the forefront of everyone's mind, but this was definitely brewing in the back burner as we were all waiting to see what was going to happen, and I think it became apparent that we were getting hit, and that became the focus then. I think we did well in our survey. I don't think anybody missed a beat, and we went straight into this pandemic mode. It accelerated at such a rapid rate. It was, 0 to 100 in days. So the idea of ICUs at maximum capacity, we exceeded that immediately. These were the sickest patients we ever saw. These patients were on multiple drips, paralyzed. We had to prone them for 16 hours a day if we could. They were very sick patients. We went beyond our capacity, but I have to say, in terms of preparation, I couldn't be prouder of the staff at Greenwich Hospital, and especially every single intermediate care nurse stepped up and took ICU patients immediately. regardless of a full cross training or anything. It was just all hands on deck. We had such amazing helpers deployed throughout the building. Plenty of hidden gem critical care nurses working in other areas that came to help out. That was amazing. But yeah, I think it became clear that we needed to go beyond our four walls. No grumbling, no complaining. It was really something phenomenal to watch.
COVID hit us really hard and fast. We were not expecting the volume, the acuity, the constraints on the system. We had tried with emails circulating everywhere to anticipate a pandemic, but no one really knows what it's like to work in a pandemic until it's actually upon you. And I recall that I was on that first weekend and you could sense the fear in everyone. I was afraid, the nurses were afraid, the residents were afraid, because we didn't know how contagious it was, we didn't know how lethal it was, we didn't know what to expect. And we did it anyway. That first weekend, we organized around the idea of doing real critical care with central lines, with good ventilator protocols, with proning, etc. All things that we knew in theory how to do, but we needed to really practice it. I was listening to a talk by Dr. Fauci this week, and he stated that the mortality rate for COVID in the Northeast was around 20%, whereas the rest of the country was seeing 3% mortality. I truly believe we were hit by a tidal wave when COVID-19 landed on our Northeast shores, probably in early February 2020. The media was reporting cases in Wuhan, and we knew that Italy was overwhelmed by the pandemic. I was following Johns Hopkins' website, which was tracking COVID infections across the world. We knew Seattle had a cluster, and about a week later, a lawyer who was commuting to New York City from the suburbs of New Rochelle was essentially the index case of notoriety for this area. Then 100 cases outbroke in New Rochelle, and a 1-mile perimeter was established around that city with the National Guard to cordon it off. Then New York City began to erupt with COVID hospitalizations. I'd say that here at Greenwich Hospital, we were uniquely positioned closely enough to the New York border that we saw the first and very severe high number of cases come our way. The COVID tidal wave hit us on March 20th. We had a few hospitalized positive cases a few days prior, and the emergency room was already churning COVID patients through its doors, but recommending that patients who didn't need oxygen were to quarantine at home. Quickly, we came to realize how extremely hypoxic these patients could become on the hospital side. We didn't have reliable information from either the CDC, who was still advising people not to wear masks, as well as the World Health Organization. The physicians in China and Italy were submitting quick-to-release electronic publications and podcasts. Brigham and Women's Hospital released a quick outline based on previous data for similar pulmonary injuries such as ARDS as a loose evidence-based summary and guideline for the frontline workers, which I found extremely helpful. Essentially, the message to us physicians was, use evidence-based medicine. We know how to do this. We know how to take care of these patients. That was the message I conveyed to the frontline troops on the morning of March 20th. All of us were afraid, but in retrospect now, for those of us who ran to the fight instead of away from it, having something to do against COVID was almost therapeutic.
So when COVID-19 came to Greenwich Hospital, I was the administrator on call, which means I'm responsible 24/7. I worked 30 days straight in a row. Every single day I came into Greenwich Hospital. I was in the command center. I helped with staffing. I helped with creating units that didn't exist. We transformed the Noble Auditorium into a patient care area. We had half of it for triage for the ED, expecting to get a lot of patients. We also had half of it for patient care units, areas where patients could recover. We also then went to radiology, the radiology suite, and we created patient rooms that used to be exam rooms or changing rooms. And we created patient care units that did not exist before in case we got an influx of patients. In anticipation. We then went to the Garden Cafe, which is used as a social environment where people have fun, relax, have lunch, socialize, and it became a patient care unit. I remember when it really hit home to me with COVID-19 that this was a real pandemic is when our ICU, that is normally a 10-bed unit at capacity, became 36 beds. And then I realized this was something different, that we were going to be on our top game to take care of our patients the best way that we know how to do that. And working 30 days straight, every day, getting up in the morning, knowing I was coming here to do my best job, but I always had the patients first.
That first week, I don't know, I was kind of in denial. And I was probably in denial even while during it, because that was kind of the way I got through the peak, is because if I actually stopped and thought about what was happening, I'd probably be too frightened. The way I handled it is I was just in denial, and I was just like, okay, like, I'll be all right. No matter what, I'll be all right. I was all right, but that doesn't necessarily mean it was true. Like, during the peak, it was a pretty, like, surreal experience. Not something that I ever thought I'd have to go through in my life. I was never the person running into a burning building to save the dog. Like, that's just not my personality. I'm not gonna join the army and be on the front lines of things. And now I'm just finding myself on the front lines of this. Not even just being in healthcare on the front lines, but as an anesthesiologist, you're at one of the greatest risk of the whole healthcare system. It's like anesthesia, working in the ICU, and working in the ER. Like, those three are like the worst places to be. I find myself just like pushed into it, and like you don't have a choice, and you just do it, and you grit your teeth, and you just get the job done, and you hope everything works out okay. I was actually the first anesthesiologist to intubate a COVID patient at this hospital. Lucky me. Luckily, we had a PAPR, and I used the PAPR. That worked out fine. After that, I literally scrubbed my whole body down. I learned something about myself. I always thought I'd be the one that ran away from the burning building, but it turns out that I'm not. I was like surprised and I guess proud of myself in that respect, that I didn't like refuse to help, and I like rolled up my sleeves and like really got in there.
COVID-19 at Greenwich Hospital, 2020. From Mugsy's point of view, actually honored to be part of an outstanding team. From day one, most all of us jumped in to a territory unknown. We definitely had fear, without a doubt. I had an outstanding manager who really got us everything that we needed, helped us through all of it. being part of the front line to me was just so special. I love what I do. I love being a therapist, and I knew every time I walked into any room, it was a little scary, but not that scary. I just knew, like, once you're in it, you're committed. And that's what I felt like, that the rock stars of the ICU, we had a commitment that was just above and beyond. I can't tell you how being involved with staff that we just, socially will walk by in the hallways until this point, coming out of the OR, oh my God, and PACU, every name I can't even say it, but we all know who we are. Was just switching roles at any point in time and respecting each other's expertise. And then the love of the patients. Every one of them was a human life that, just holding their head in my hands and in your hands, just taking care of them the best that we could. And as many lives as we lost, the ones we saved, it's just something that we'll live with. It carries on. I think about it all the time.
I learned and was reminded of a very important lesson during this time, and that was there was a point in time when I was rounding in the ICU as an attending where I was going in and out of patients' rooms. They were known COVID exposures, and one guy had a tension pneumothorax. I drained the tension pneumothorax, and all this air came out on the shield and my gown, and emotionally it was very difficult. I actually went home because at the time we weren't sure what was happening with the how the lethality of this virus, the case fatality rates, it would be the thought that perhaps it might affect you and you might die. I actually went home that night to the kids and actually told them to where the will was in the safe and things like that. So it was kind of distressing. But the point of it is that while I was doing this rounds in the ICU, I noticed one thing that really stood out to me, and that was how I was watching everybody else working there, and specifically watching the environmental engineering staff for housekeeping who were going into the rooms and cleaning the bins. I was watching the respiratory therapists who were helping us intubate the patients, and as well as the nursing staff, the people that volunteered. And although at that time I was kind of focused on the distress of, am I going to make it through this? That kind of thing was, that goes through your head. The reality was, it taught me that we're really all dependent on each other. And I have an incredible respect for people who aren't always recognized, like the housekeeping staff and all the other staff that actually had constant exposure to patients with COVID in the ICU. So what it taught me is that we are dependent on each other, and we're one big team. And that's the lesson that I learned from this time.
Hello, my name is Ellen Larabina, and I'm an RN at Greenwich Hospital. I'm presently the clinical coordinator of the Helmsley Ambulatory Surgery Center. During COVID, I was in charge of RN deployment for the Staffing Command Center. The entire Command Center team was made up of incredibly focused and take charge kind of people. We didn't know each other. We worked at different areas. We were told we need staff, we need RNs. Go to it, get it done, and we did. We were given call lists from all the offsites and closed units, departments like NEMG, IVF, physical therapy, cardiology, behavioral health, outpatient pediatrics. We spoke with unit secretaries and deployed them to ICU, off shifts, nights, weekends. We spoke to paramedical aides from offsites that went to be runners, screeners. We had nurses due to health condition and other circumstances that couldn't work the floors or in COVID areas. They went to housekeeping, scrubbed elevators, they went to transport and brought food and equipment to each unit. It was amazing what a community that came together with ingenuity and determinedness and creativeness. It was just an experience that I will never forget. What we established early on was to call all the staff that we deployed 24 hours prior to their next shift. We did this for a couple reasons. We wanted to check their health status. We wanted to make sure we had coverage for the next day. But most importantly, we wanted to make sure that this staff was doing okay emotionally. If nurses needed a day off or they needed a break from a certain area, we would rearrange the schedule and give that to them. What I found that staff was so resilient that if you gave them some control over what was going on, they were able to bounce back and come back to work under circumstances that previously were unimaginable. What I realized about nurses is that everyone needs a buddy, that nurses do better if they're in familiar surroundings, that consistency is the key. If nurses were allowed to go back to the same unit consecutive times, they were able to develop a relationship with the staff and a working knowledge of the unit. This gave them some comfort and they felt supported. I am profoundly changed by this experience. I have COVID companions that I'll have a bond with for the rest of my life. What we are seeing these days are the best and the worst of humanity. I do believe in people. I believe in relationships. My priorities have changed, and some things don't matter anymore. I am a thankful person. That's it.
Look at this face, I know the years are showing. Look at this life, I still don't know where it's going. I don't know much, but I know I love you. And that may be all I need to know.
Look at these eyes, they've never seen what matters. Look at these dreams, so big and so better.
I don't know much, but I know I love you. And that may be all I need to know.
Thank you, administration, for all your love and support. You have all been there for us from the start. We thank you. We feel loved and cared for. We thank you.
After another, see, I was blind to the sun by my thunder, and now my vision is all in color. It's like a rainbow, tropical kind of summer. Usually by now I feel a shiver and I'm getting cold feet, but that's the only. Oh,
nurse many, many years ago, and this is what it's all about.
Asking, but now I'm taking. I took a chance, now I'm living on a spaceship. And now I'm flying, cause I can face it. Part of the stars, I'm in every constellation. Usually by now I feel a shiver and I'm getting cold feet. But that's the old me. Oh, what it's like to be human. What it's like to feel love like this in a place like this. I feel human.
Back him, I'm a savage. Classy, bougie, ratchet, sassy.
What it's like to be human. What it's like to feel love like this in a place like this. I feel human. Asking, but now I'm taking. I took a chance, now I'm living on a spaceship. And now I'm flying, cause I can face it. Part of the stars, I'm in every constellation. Usually by now